Okay, so welcome to my YouTube series focused on healing and resilience in Saskatchewan social workers. This series is a part of my graduate degree, Capstone Project, and I chose it because most of my social work education and career have focused on healing and resilience in some capacity, whether it's through engaging in alternative healing practices like expressive arts therapy, or even just personal reflection on my own healing journey and how that impacts and shapes my practice. So I am curious to hear how these factors are a part of the practice of other social workers like yourself, specifically in Saskatchewan, because this is the province that I've called home for the last 15 years. So today my guest is Petryk, and hi, Crystal, and thanks so much for being
Hi.
here.
Thanks, Heather. Thanks for having me.
For sure. So can you just start us off by introducing yourself, maybe a little bit about your practice and your role as a social worker?
Yeah, so absolutely. I own my own practice here in Saskatoon, Crystal Petryk Clinical Consultation and Counseling, a bit of a mouthful. But I have been a practicing MSW, RSW social worker for the last 18 years. All of which have been in the mental health and addictions area of direct practice with child, youth, and adults. However, in my current private practice, I simply see adults to keep it a little bit easier in terms of the virtual work that I offer. And I work in the area of women's mental health specifically.
Okay. You have such a wide range of experiences too in your career. And that was one of the reasons why I really wanted you to be a part of this. So I'm so
Thank
excited
you.
that you're here.
Yeah.
I'm asking each person kind of why, well, obviously we did virtually because of our locations.
Mhm.
Um, but I'm also encouraging people to maybe tell viewers about the space that you're in and why it's meaningful to you. So do you mind maybe just telling us a little bit about where you are?
Yeah, so I'm located in my home office on the main level of my house, and I've been so blessed to be able to create this private practice out of my home. After having worked in a public service for that many years and working in oftentimes an uncomfortable office space that had too much air conditioning or too much heating and more of a hospital medical kind of approach in terms of the decor and that and the environment. So my home office I've created to be a really comfortable, cozy space for myself, a place that I look forward to going. The temperature's just right. I have some of my favorite objects and items around me. Obviously you can see sort of the background behind me, but in front of me I have a few other things that I enjoy looking at as well, because environment for me has been really important in my own sort of self-care in the professional field.
So good to hear. And I always like, well, I've, obviously worked with you before and I love the feather painting in the background. I just find the colors really soothing and
Yeah,
the view is so nice from our perspective too. So I think
good.
that can be really important. So thank you so much for sharing about your space.
Yes.
So today we're talking about healing and resilience, and I've sent some questions ahead of time. I'm going to start with the first one just to get the ball rolling, and we'll see how we kind of go back and forth from there. So I was thinking we'd start by talking about a time where your personal approach to healing made a difference in maybe a client's life and some things that maybe you learned about that experience.
So definitely a lot of my practice areas that I'm currently practicing in are and have been sort of evolved out of my own personal experiences.
Mhm.
And as I was reflecting on the questions earlier on today, the first thing that came to mind for me was my own personal experience going through the infertility process and accessing fertility treatments, as well as then going through, fortunately, one successful pregnancy, however, unfortunately, many pregnancy losses, and then postpartum as well, having some struggles there.
Mhm.
I've been very cautious around how much I share with that, but those experiences have, I believe, allowed me to engage more effectively with the client, but then also build that trust and that compassion and that connection that then hopefully, and from what I've been able to see, helps the client then in the space that they're at learn to continue to kind of push forward and be patient and compassionate towards themselves as well. So that's my most favorite area to work in because of my personal experiences, which I'm sure isn't uncommon in this field.
No, not at all. You brought up a really good point too about how you do share bits and pieces of your story, and I've read some things of your posts on social media and stuff, which I just find very vulnerable and very authentic when you do share those pieces. Um, do you find that that's almost like a connecting point for clients when they see that vulnerability and that storytelling in a way that you're comfortable in doing so, that that's maybe an access point for them to you?
Think so. That's the
Yeah.
feedback that I've received. You know, like I said, being quite cautious about how much I'm sharing, and certainly recognizing that my experience doesn't necessarily reflect the exact circumstances that they're experiencing. But I
Yeah.
think we all look for those pieces of connection when we're looking for some type of emotional support person, right? So I have heard that that's one of the things that they appreciate is that I can say that I've walked, you know, in similar shoes to them throughout that experience, as well as having the training and the clinical
Mhm.
experience as well, which is really important.
Yeah. And centering the client's story, like that recognition that their journey is going to be different than yours. So what you've gone through is one component of it, but there's so many other avenues to take. So that's really good.
Mhm.
So you most likely have some fairly built up resilience in your life, considering some of the things and lived experiences that you've gone through. And that's, even from a general perspective, we all have our own lived experiences that help shape our form of resilience. So, what are some tools or strategies that you have done to cultivate resilience within yourself? And then maybe some of those ones that you've brought into sessions with clients?
So certainly over the years, I feel like I've learned more about how to implement self-compassion, and
Mm,
whether it's from different readings or just examples of some of the clients that I've been able and blessed to walk alongside, but been able to apply that to myself over the years. Of course, it's evolving over time, right? We're not always great at things when we start, but the idea of self-compassion is something that I know for myself was really important to hold on to throughout some of the difficulties in my personal life. And so I'm able to translate that in my work with clients now in similar circumstances. Mindfulness practice has been something for me along the way, regardless of the personal experiences I've been going through over the years. I have been able to learn about and practice and participate in groups for mindfulness work. And I just know the power and the impact of regular practice. And so that's certainly something I advocate strongly for is figuring out how to connect into present with your body and the impact then on our mind.
mm,
And then also the other piece I think that's unique is I recognize radical acceptance and acceptance of sometimes the unfortunate circumstances that we're in, and that's certainly a tool or a technique or a strategy that I use when I see that the client is opening to that. It's not necessarily something you want to suggest to somebody initially, but I can see from my own experience how important it is to come to a piece of acceptance,
mm.
as well as being patient with oneself. And some of those more kind of personal values also play into what I can translate in my work with clients.
Yeah, absolutely. So lots of yourself brought into it, that personal value piece. I'm familiar quite a bit with applying self-compassion and mindfulness. There's so many wonderful resources out there. Radical acceptance, I have mostly heard actually in a yoga class where
Oh,
one of my lovely instructors that I see, she talks about radical self-acceptance as part of her intro and outro in classes. So is there, are there any particular resources that you kind of maybe share with clients or have used yourself that you find quite powerful in that
yeah.
topic?
Nothing specifically that I can think of off the top of my head, but we often talk about the theme in general. Like
Okay.
I do think we do generally have hold more acceptance than we give ourselves credit for. And so even, you know, just using opportunity to dig around a little bit to find other space in the client's life that they might be able to connect with the idea of acceptance. Although it might be uncomfortable, it might not be a preferred way of thinking, feeling, or being. How do you, you know, sort of accept that as a part of your life experience currently, right? And
Yeah.
so certainly with infertility and postpartum, and there's pieces that they can control and change, and there's pieces of it that you just sort of have to learn be okay with the discomfort and accept it for what it's at right now.
Yeah, that's a really fair point to make too. We've talked a little bit about your journey towards resilience and healing, and I'm wondering if there's more to add about how maybe that journey has influenced your work with clients or your approach to clients, and if there's even like a tangible example, like one of those in action sort of ways of, hey, this was one experience that just stands out to me, confidentiality in mind, of
Yeah.
course,
Yeah.
with something like that. But yeah, wondering if there's more to add with that piece.
I can think of one that's fairly recent. I certainly see people along the kind of broad view of infertility, right from the beginning of sort of trying to conceive and wondering what's wrong to receiving a diagnosis that sort of makes or breaks the decision around how they're going to need to approach it. And it can be easy to rush into problem solving and rush into planning for what the next steps are, especially because clients are quite anxious to have the next steps when they do find out. And so I'm often reminded in those moments when I feel that urge, how important it was for myself to have somebody that just listens and validates and supports.
Yeah.
And so I found myself recently reminding myself of that with this one client who, although I could see there were a lot of questions and things and options that she could look into and consider calling and all the things, I had to really hold myself and realize that it's important to sort of slow things down, that those things will come,
Mhm.
that the news she just recently received was really something she needed to spend some time in, right? And not busy herself doing a lot of other things. And so I just realized how much I use my own experience and reminding myself how important that time frame was to
Mhm.
and I was lucky to have somebody to work with at that time that was really great about knowing the timing of when to kind of start offering resources and such. So
Yeah.
really helped me slow things down with this particular client.
Think that message of slowing things down is so valuable, especially for new or green folks going into the field of social work, where we have all of these new tools and skill sets and training opportunities that we've spent the last 4 years kind of diving into, and want to try all of these interventions out. And I feel like sometimes there can be a lot of pressure to almost perform. Okay, so this person, my client said this, I can use this intervention. When the basics of just listening and validating can be exactly what's needed in that moment. So I
Yeah.
really appreciate that reminder in that story.
Yes.
Yeah. Yeah. Very cool. So you mentioned values, bringing your value system in just a few moments ago. In what ways or other ways do you think you bring values and beliefs into your practice to foster that sense of resiliency in yourself or in your clients?
Yeah, I can definitely think more so around clients. So I'm very attachment based in my practice.
Yeah.
And so we often end up looking at sort of the core beliefs that we establish as young children, and more specifically, core beliefs that can impact us negatively throughout our lifespan. And so oftentimes we're looking at those early beliefs and sort of how can we look at them differently and shape them differently to be more of a preferred or neutral belief.
Mhm.
And so I take that approach a fair amount with clients and sometimes even include my own kind of learnings around what my beliefs have been over the years and where they've sort of reared their ugly heads on occasion in different relationships, right?
Yeah.
So lots of sort of attachment based stuff around beliefs. How did we develop those? Where did you learn that from? Where does that show up for you today? And I find people really connect with that. Whether it's they connect with it because that's the value system they grew up with, or because they've developed this value system out of the need and necessity to do it because of their childhood and upbringing, right? So and I think definitely working with women's mental health, my strong belief of building women up and feeling empowered and taking away some of the pressures that society puts on women that I too have experienced, as a mom, as a woman, as a partner. Lots of talk about what do you want to be, right? Who do you want to show up as? And developing that within themselves as opposed to developing that within systems of families and work and all the things. So that piece is really important to me as well.
Which is why I always turn to you for things, because I'm learning that my practice is really attachment based and foundation as well. And then women centered approaches and those systemic structures that are at play against them. I'm writing a paper right now, and it's part of this whole Capstone project. We're starting it, and there's an end in sight, and we had to pick two theories that support our practice, and it's attachment and empowerment that I ended up
Yeah.
choosing. So it's so interesting to me,
Yeah.
yeah, that in this interview, those are the ones that are really kind of coming up.
Yeah.
So maybe it's a sign that I'm on the right
Maybe
path
it
for
is.
what I'm choosing.
I think so. Yes. Yes. Well,
Yeah.
I mean, in my opinion, you can't go wrong with
No. Well,
areas.
and so going back to something you said with attachment based, like where does that belief come from is definitely a common question that I utilize in practice too. But I also like your one, where does that show up for you today? And I feel like that's got to be added to my toolbox as well, because then it brings us from the past to, okay, but now we're here and what are we doing with it? So I appreciate that insight quite a
Yeah.
bit. I'm writing some scratch notes down here as we're talking too.
Yeah.
Okay, and so then our final question is just focused on any, a transformative lesson that you might have learned in your career about fostering healing and resilience. And this can be for yourself, this can be for your clients, this can be a combination of both, just generally across practice.
So the first thing that came to mind when I read that question earlier was, as a professional, as a practitioner, is take care of yourself first, right? The whole if you're in an airplane and it's going down, putting the
Yes.
oxygen mask on. And I think that applies to women in general,
Yeah.
because that's not our instinct, right? Our instinct is to take care of everyone else and leave ourselves behind. And certainly coming from a public system, I mean, that fosters that exact approach, right? It can feel really difficult working in a public system to feel like you have value and to feel like you're there for anything other than to serve the numbers coming in, right? And so one of the things I reflect on in my career is how important it is to take care of yourself, even above your clients. I mean, to say it so broadly or boldly like that, but if we don't take care of ourselves, then we're no good for our clients. And so whatever that means, whether it's changing your work environment, changing your living environment, making sure that you feel like you're getting your needs met, it's just as important as your clients, as your family members, right, as your colleagues. And so I think that's a lesson that I have been taught many times over my career and my life, and
Yeah.
even the experiences we talked about earlier. It's sort of that you're always doing something for someone else, or you're always doing something to keep, a certain appearance on or a front on. And I think as you get further along in life, you start realizing how important it is to take care of this behind the scenes, which is yourself, right? And the rest of it will fall into place. But I mean, it sounds cheesy. So it's sort of that a self-care piece in our work, and whatever that looks like is very important, because the rest of it will fall into place, right?
Yeah. You're
Yeah.
leaving it so open for each individual social worker to create whatever that looks like for them. Like how do you take care of yourself? And it doesn't have to match a checklist of what people should or shouldn't do. It has to feel right, for that behind the scenes version of you, and what does that side of you need. So
And
I think
that's
that's such,
okay. I think
yeah.
many generations, I'm a Gen Xer, like we were taught you had to do it a certain way, right? You have to work 8 to 5, you have to work 40 hours a week, you have to do this to be a good partner. And so for now, we're seeing a lot of the younger generation saying, no, I don't want to do that, right? I can make it work in another way. And as much as I sometimes get frustrated with different generational approaches, like I would actually say that's pretty empowering. It's quite interesting to see how that continues to evolve in our professional workforce. Yeah.
I think it becomes a little bit about self-advocacy for the
Mhm.
professional too. We talk so much in social work about advocacy for the clients and building their sense of autonomy and their voice up. But I think you're speaking to that point of advocacy even for what we need in this
Yeah.
journey too and in our careers
Yeah.
to be effective social workers, right? With the vulnerable
Just
population.
have to we have to like our work and be passionate about
Yeah.
our work in order to do
Yeah.
good work in this field. I mean, you can get away working at a flower shop, making flower bouquets without having to have
Lovely.
the passion, right? But in our work, you have to be able to connect at the heart level with
Mm,
clients.
yeah.
And we all know the ones that struggle, with burnout or
Mhm.
start having issues, right? And
Yeah.
so, yeah, for sure, if earlier on a person can kind of shape their work to fit their needs rather than them shaping to fit the organizational or system needs,
Yeah.
that might be one way to approach it.
Yeah. Change making, starting
Mhm.
within ourselves. Very
Yes.
good.
Yeah.
Okay, well, thank you so much for sharing your thoughts. I look forward to sharing this on YouTube and with my peers in my MSW program, and to connect the dots between the interviews that I'm doing over
Yeah,
the
it'll
next
be
couple of
interesting.
months. Yeah, to see what
Can't wait to
themes
see
are
the
there
evidence. Yeah.
and yeah, all of that. So,
Yeah.
okay, well, thank you so much. I'm
Thanks,
just
Heather.
going to stop recording for us.